We're really excited about this year's meeting. We think it has a lot to offer all caregivers that are involved with patients with heart failure. One of the important focuses for us at the meeting is to make sure people realize that the heart failure disease state is really multidisciplinary. We have physicians at sessions on the podium with nurses and pharmacists really looking at best practices to manage these patients. We have several sessions focusing on guidelines and what's the best guideline practice for our patients, both in the hospital and the clinic, especially in managing patients with acute heart failure, which again is an area where there are several clinical trials currently being conducted. There's going to be a lot of emphasis this year on mechanical circulatory support devices that are surgically implanted in patients with advanced heart failure, as well as some of the implantable devices that we put in the cath lab. There are several sessions that are going to highlight issues that we deal with in managing these patients, including right ventricular failure, infection, GI bleeding, and thrombosis. We're also going to be looking at strategies to better select these patients for these therapies. And we're also going to have several interventional cardiologists here really talking about some of the implantable devices that we put in the cath lab. More and more, this is a growing population of patients that we're seeing and we're managing, and there's really a collaborative approach with our interventional cardiology team, especially with the percutaneous support devices. Heart failure readmissions is clearly a hot topic that we've been dealing with for a few years now. And clearly CMS has set a metric whereby hospitals need to minimize heart failure readmissions. It's a metric that's going to be debated here as to terms of whether it's the right metric that we should be using. There's going to be several sessions looking at better ways to manage patients to try to minimize readmissions, as well as there's going to be a debate on the topic of whether or not heart failure readmissions is the best thing that we should be focusing on as heart failure physicians. In terms of health reform, there's a big focus on health reform as part of the program this year. The plenary session, which is going to kick off the meeting, is really focused on healthcare reform. There are going to be several discussions by speakers at the plenary session looking at how we can decrease the cost of healthcare, how hospitals are going to deal with healthcare reform as it moves into the future, and also really reviewing the Affordable Care Act and how it's going to impact physicians over the next several years.